A prostatectomy is a surgical procedure for the partial or complete removal of the prostate. A total procticolectomy is surgical removal of the colon, rectum, and anus. After surgery, a Foley catheter is placed to drain urine. Prostatotomy is a surgical incision of the prostate. Retropubic vs suprapubic vs perineal. A retropubic prostatectomy describes a procedure that accesses the prostate by going through the lower abdomen and behind the pubic bone. A suprapubic prostatectomy describes a procedure cuts through the lower abdomen and through the bladder to access the prostate. A perineal prostatectomy is done by making an incision between the rectum and scrotum, perineum. Prostatectomy, perineal, subtotal, including control of postoperative bleeding, vasectomy, metotomy, urethral calibration, and/or dilation, and internal urethrotomy. The physician performs a prostatectomy, removal of the prostate gland, through an incision made in the perineum. Through the perineal incision, a portion of the prostate or the entire gland is removed. A Foley catheter is placed in the bladder. Prostatotomy, external drainage of prostatic abscess, any approach, simple. Complicated. The needle is inserted into the abscess in the prostate guided by an index finger or by ultrasound and the contents of the abscess removed by aspiration. Report 55725 if the procedure is complicated by excessive bleeding, infection, or other problem. Vesiculotomy is a surgical incision of the vas deferens. Vas deferens is the tube that carries spermatozoa from the testis. Vesiculotomy is a surgical incision of a seminal vesicle. Orchiectomy is the surgical removal of one or both testicles. Orchiectomy, partial. The surgeon makes a longitudinal incision midline in the scrotum to expose the testis. The testis is excised periosteal. The wound is closed by suture and a pressure dressing and scrotal supporter are applied. Orchiectomy, radical, for tumor, inguinal approach. The physician performs a radical orchiectomy by removing the contents of half of the scrotum. An incision is made in the inguinal area from the pubic bone toward the lateral pelvic bone. The testis and all its associated structures are pushed up from the scrotum into the incision and removed. Orchiectomy, radical, for tumor, with abdominal exploration. A midline incision is made from the upper to the lower abdomen and the abdominal cavity is entered. The back wall of the abdomen is exposed and the lymph nodes are checked for spread of tumor. Some may be removed and/or biopsied and the abdominal wound is closed in layers by suturing. Vasotomy, cannulization with or without incision of vas, unilateral or bilateral. Under local anesthesia, an incision is made in the upper outer scrotum and expose the vas deferens. The tube is entered by puncturing with a small needle and fluid samples removed or solution injected to check for blockages. Vesiculotomy. Complicated. The physician incises or punctures one of the seminal vesicles. The seminal vesicle is approached through an incision in the lower abdomen or an incision in the perineum. Frenulotomy of penis. The physician performs an incision of the membrane that attaches the foreskin to the glans and shaft of the penis, frenulum. A longitudinal incision is made ventrally through the outer layer of the prepuce. After retracting the prepuce, the physician extends the incision along the inner layer. Bleeding is controlled with an electrocoagulator. The resultant wound is closed.